Good morning, everyone. Thank you so much for joining our webinar today. The title of today's presentation is Tobacco 21, What You Need to Know About Policy Initiatives, FAQs, and Impact. You'll leave knowing the following things after today's webinar. First, you'll leave knowing the impact of Tobacco 21 policies on youth tobacco use. You'll know the value of passing this policy locally, the influence that local policies have on creating statewide change. You'll also leave knowing what some responses can be to some of the frequently asked questions that we hear from community members. We know that a lot of you are working at the community level and so are interested in knowing how to respond to your community's concerns and questions related to this topic. You'll also leave knowing some lessons learned from community organizers in Minnesota who have been working locally or on this policy at the local level recently. And finally, you'll leave knowing some talking points, tips, and also some tools if you're interested in pursuing this policy in your community. With me today, I have Isha Seth and Alicia Busey, who will be presenting the bulk of today's webinar. Isha is the Technical Assistance Program Coordinator for the Association for Non-Smokers Minnesota, and Alicia is the Health Educator and SHIP Coordinator. SHIP stands for Statewide Health Improvement Program, and she works with Mille Lacs County and has been working on a Tobacco 21 policy in Isanti County most recently. My name is Lindsay Smith. I'll be your moderator for today. I'm the project director for the Minnesota Prevention Resource Center. And so with that, I'm actually going to turn it over to Isha to get us started on today's presentation. So Isha, take it away.
Hello again, everyone. This is Isha, and I will be talking about Tobacco 21 in Minnesota and the issue of tobacco in the state. So starting out first with why is raising the tobacco sales age an effective way to reduce youth tobacco use? Youth tobacco use is still a problem. In Minnesota, it is the #1 cause of preventable death and disease. In Minnesota, 19% of students have used tobacco in the past 30 days. 9th and 11th graders are now using electronic cigarettes at twice the rate of regular cigarettes. In addition to that, flavored tobacco products are appealing to youth. 95% of current adult smokers started before they were 21 years old. If youth don't start by the time they're 21, they likely never will. Ages 18 to 21 are a critical time when young people move from intermittent smoking to daily use. 4 out of 5 experimental smokers become daily smokers by the age of 21. Keeping tobacco out of high schools will reduce the number of youth under 18 who become addicted to tobacco. The human and economic cost of tobacco: over 6,000 Minnesotans die each year from tobacco use, and smoking costs Minnesota more than $3 billion annually in excess healthcare costs. Many youths are getting tobacco from older peers. 59% of 18 to 19-year-olds have been asked to buy cigarettes for someone younger. 63% of 12 to 17-year-olds who smoked in the last month gave money to others to purchase cigarettes for them. That is a very high number. High school students are less likely to be around a 21-year-old than there are to an 18 to 20-year-old in a setting where they could ask someone to buy tobacco for them. The impact of nicotine on the adolescent brain. No amount of nicotine is safe for youth. Evidence suggests that nicotine interferes with the brain maturing and can have long-term effects on cognitive development and mental health. The addictive properties of nicotine are particularly harmful to youth and can lead to heavier daily use and a difficult time quitting later in life. The tobacco industry is targeting youth regularly. The tobacco industry uses cheap prices, appealing flavors, and targeting advertising to appeal to youth. They spend over $115.8 million on marketing each year in Minnesota. The industry is constantly looking to replace smokers who die from diseases related to tobacco use. So that is some of the rationale and the issues related to tobacco in the state. What is Tobacco 21? There is a misconception that many people can just cross off 18 and add 21 to their local ordinances, and that will be it, but it's a little more nuanced than that. Tobacco 21, so everyone is on the same page, is raising the minimum legal age to purchase tobacco products from 18 to 21. This includes all tobacco products and tobacco-related products, so cigarettes, cigars, electronic cigarettes, hookahs, anything that would be considered a tobacco product. So updating definitions in ordinances that may be outdated. Tobacco 21 also does not penalize youth under 21 for purchase, use, or possession of tobacco products, since this is not found to be effective in reducing tobacco use, and it would criminalize communities of color. Tobacco 21 is aimed at retailers, the tobacco industry, and social sources that youth are able to purchase tobacco products. Many cities and counties have taken the time to thoroughly review the existing ordinance on licensing, fees, compliance checks, ordinance, etc., when they're working on the Tobacco 21 ordinance. The Public Health Law Center, that many of you might be aware of, is available to review local ordinances, provide feedback, and provide model languages for your city. This is a quote directly from the tobacco industry in 1986. So way back then, they knew that raising the legal minimum age for the cigarette purchaser to 21 could gut their key young adult market. So has this policy shown reductions in tobacco use? There's some data. There hasn't been a lot of evaluation done yet since this is a pretty new policy initiative, but there is some data that I'll be discussing. Needham, Massachusetts was the first town. It's a suburb of Boston. In 2004, they raised their age from 18 to 21 to purchase tobacco. They had a nearly 50% decrease within 5 years amongst the high school students of tobacco use. Frequent smoking also decreased by 63% in Needham. Chicago, Illinois, they passed their Tobacco 21 policy in 2016. There were 9.7 18 to 20-year-olds who used cigarettes or electronic cigarettes in 2016 compared to 15.2% before Tobacco 21 passed in Chicago. This was a 36% decrease. There have also been some studies on Tobacco 21. The Institute of Medicine report suggested that raising the tobacco sales age supported raising the tobacco sales age and found that it would decrease the number of youth that started to smoke and would reduce smoking initiation among 15 to 17-year-olds by 25%. Tobacco 21 in Minnesota. In the Minnesota Medicine Journal, there was another study that said that 30,000 fewer youth will become smokers over the next 15 years if the tobacco sales age was increased to 21. A quick state legislative update. There have been lots of questions about what is going on at the state on Tobacco 21. There's a bill in the House and the Senate. In the House, House File 331 was approved. There was a hearing and approved on all the committees listed here. Most recently, it was laid over by the Health and Human Services Policy Committee to be included in the House Health and Human Services Omnibus Bill. The House bill, House File 331, has 24 co-sponsors currently. In the Senate, there's only been one hearing in the Health and Human Services Policy and Finance Committee, where they approved it and passed it on to the Judiciary and Public Safety, Finance, and Policy Committee. They have not held a hearing on the bill yet. And there are 5 co-sponsors of Senate File 463. So I'm going to go into some frequently asked questions from community members on Tobacco 21, some opposition that you might hear against the policy initiative. So this is a very common one. If someone can join the military at 18, shouldn't they be able to buy tobacco? Our response is 18 is not a magic number. Tobacco industry lobbyists imply that smoking is a right and not an addiction. We want a military force that is physically ready, and tobacco use impairs that. The Department of Defense and other armed services have stated a goal of a tobacco-free military, and there are already legal safeguards in place to protect the health and safety of our young people, such as the drinking age. Why should our community work on passing this policy locally? This is also a very popular question, since people feel like the state should, since a lot of communities feel like the state should handle this. Our response is that Minnesota has a strong history of local governments acting to protect the health of their communities before the state legislature takes action. The most powerful incentive for the state legislature to act is the initiative of local citizens and decision makers to make local policy changes. This is how the Minnesota Freedom to Breathe Act became state law. Cities and counties across the state made their bars and restaurants smoke-free, and then the state acted on this. So incremental change is progress. And the other reason is that this Tobacco 21 policy uses the local licensing authority. Tobacco vendors are licensed locally by the cities or counties, and passing this policy uses the local licensing authority to enforce this policy. Another question, very popular question, is won't youth find other ways to get tobacco regardless of what we do? Tobacco 21, like I mentioned earlier, addresses social sources that youth are getting tobacco from. 75% of smokers ages 15 to 17 are getting tobacco from social sources, their peers, friends, etc. High school students are less likely to be around a 21-year-old than an 18-year-old. This is a popular response from opposition, a question from opposition. Will Tobacco 21 hurt retailers? 18 to 21-year-olds make up roughly 2 to 4% of tobacco sales, but provide tobacco to majority of underage smokers. Those 18 to 21-year-olds are the pipeline to other youth. Retailers may sell non-addictive, non-disease-causing products that can offset any losses that they might have from their sales of tobacco. And the health benefit of saving kids from a lifetime of addiction and disease outweighs retailers having to adjust to a decline in sales. Another question, why should electronic cigarettes be included in Tobacco 21 policies? Electronic cigarettes are considered tobacco products in federal and state law. Electronic cigarettes have not been proven to be better for quitting smoking and have not been approved by the FDA as quitting aids. While smoking rates are falling, electronic cigarettes are a way for the tobacco industry to keep hooking the next generation on their products. Finally, couldn't Tobacco 21 be used to target youth and communities of color? Like I mentioned earlier, the focus is not on the youth, but on the seller. Tobacco 21 would not penalize youth under 21 for purchase, use, or possession. It's known as PUP for Tobacco 21, since this has not been effective in reducing tobacco use. National and statewide leaders will not support Tobacco 21 if it includes PUP. Now I'll pass it on to Alicia, who has been working in Isani County for over a year to pass the Tobacco 21 policy.
Hello, everyone. Can you hear me?
Yes.
Okay, wonderful. Thank you, Isha, for all of the wonderful information that you shared about T21. Very informational. Again, my name is Alicia Fusi, and I am the Health Educator and SHIP Coordinator from Mille Lacs County, serving the region of Isani, Mille Lacs, Kennebec, and Pine County. For those of you who may not be familiar with SHIP, it's the statewide health improvement partnership that focuses on chronic disease prevention through increasing physical activity, healthy eating opportunities, along with decreasing tobacco use through various strategies. My primary role with SHIP is tobacco prevention with emphasis on the point of sale. I'm here today to walk you through our journey of Tobacco 21 in Isani County. If you don't know where Isani County is, it's this little red dot on the map in the east central region. We're a fairly rural county considering our proximity to the metro with a lot of small town community feel. So now that you have a little bit of background context on who exactly I am and where Isani County is, we will move on to the next slide, please. So today I'm going to talk you through our journey to Tobacco 21 and what steps were implemented to get there. As you can see from the above slides, there were a few important steps that I highlighted and wanted to bring attention to. I do want to note that this process took approximately 2 years. So although it looks quite simple in the context of a timeline frame, it was quite lengthy. So I'll go into detail in the coming slides regarding the steps reflected. So the first step through this process was framing the issue and figuring out how we could leverage community resources to have the largest impact on the extremely high youth tobacco use rate. Using the Minnesota student data, we were able to pull together some graphs to give an accurate visual to utilize when presenting and talking with community members and decision makers. We started with presenting a basic tobacco education and e-cigarette PowerPoint at local coalitions throughout the region and to the Cambridge Medical Center Community Engagement Council. They're an affiliation with Align Health, in case anyone was curious about that. It was at this meeting that we connected with Deb Netzel, who was the chair of the local Isani County Substance Abuse Prevention and Recovery Coalition. That's a very, very long title, so I will refer to that as the coalition from here on out. The presentation to the local coalition was requested, so we went and presented that same presentation to the Isani County Coalition to frame the issue of the county youth tobacco use, and that also had a very large impact on them at that time. So then they also reflected back that they had no idea that e-cigarette use was that big with our youth. They recognized the urgency of action and talked about how they could address and help alleviate youth tobacco initiation within the community. So we talked a lot about community readiness and about the landscape of the community, such as core values and viewpoints. One of the other findings within the Minnesota Student Survey data was about perception of their community caring about them. And a lot of youth noted that they didn't believe their community cared about them. And so that actually kind of struck a chord with a lot of our community members, and they using those two data sets, we were able to establish a team of people who were extremely passionate about this specific topic and were wanting to do more to help. The coalition wanted to push forward with policy changes quickly, but we emphasized the importance of building support and community capacity through each individual network. So from the very beginning, we emphasized the importance of taking the correct steps and that this work is not fast moving. It takes time and a lot of it. After roughly 2 to 3 meetings with the coalition, we connected with outside content experts such as Association for Non-Smokers and Minnesota Department of Health on support moving forward. They helped us grantees develop a strategic plan, which was modified multiple times as we worked through the process. So then our next step was, where do we go from here? So we actually developed a subcommittee, which was a tobacco, we called it our planning team. With a unique community like Isani County, we needed to ensure that there was a broad representation. So we, as a subcommittee, had to talk about who we were going to bring to the table and who we may be missing. So we had the coalition chair, so Deb, a social worker, public health director and public health representative, county attorney and assistant county attorney, school chemical health specialist and school representative, law enforcement, healthcare representative. But I do want to note, if I could redo the planning team, we would definitely involve youth throughout the entire planning process. We did have them volunteering at a lot of our outreach events and at some of our education forums, but I would include them from the very, very beginning so to gain their knowledge and understand how this could potentially impact them or their peer groups throughout the implementation process. You can go to the next slide, please. So I'm going to talk a little bit about why cross-sector collaboration is important. And I did see a lot of our participants were from public health, so this may be redundant, but for those of you who may not be as familiar with it, cross-sector collaboration is extremely important because it builds on professional and personal experiences that may be different. Viewpoints are also different. It allows voices throughout the entire community to be heard and allows teams to leverage resources and build on strengths. We wanted to ensure that there was an equitable representation across the entire community and that all sectors and all voices were heard and considered throughout the entire planning and implementation process. With that, we also didn't want all of the work to fall on one person, so small tasks were assigned for everyone on the team. Everyone took equal responsibility in the deliverables needed and for the most part, always met them in a timely manner. It takes community to do this work, and I definitely want to emphasize and re-emphasize how important that was for us. You can go to the next slide, please. So now it was time, we had our planning team established, and now it was time to educate, educate, educate. We wanted to educate our entire community, not just the coalition themselves. So as a subcommittee, we organized 3 educational sessions that were open to the public. One within each city in Isani. There's 3, so not a whole lot of work to do on that point. So we had one in Bram, one in Cambridge, and one in the city of Isani. We also had one-on-one conversations with decision makers, city officials, community stakeholders to raise awareness and build community support around this topic. There was a ton of effort on the coalition's behalf regarding outreach to local papers, articles on why tobacco is still a problem in Isani County, outreach events at Isani County Fair and Downtown Appreciation. And so some of these pictures represent those various outreach events. And then we also, with Alina Health, we created informational packets that included local statistics and infographics on tobacco use in Isani County to hand out at these outreach events. When we did this education piece, we didn't talk about policy options at all, really. It was merely educational sessions only on the local youth tobacco use rates and education on tobacco point of sale tactics and health risks. You can go on to the next slide. Thank you. So from there, we really had to kind of hone in and focus on exactly which policy we wanted to work towards. And so with our subcommittee, we brought it actually back to the entire coalition as a whole, and we did a vote. And so we gave them 2 little sticky dots, and we gave them options such as the ones pictured. And I would say 99.9% of all dots fell on tobacco 21. And so that is how we kind of reached and got on the same page as to which policy we wanted to move forward with. Move to the next slide, please. So from here, we actually had set a committee of the whole meeting, which was held on September 17th, 2018. It was structured as an informal board meeting where decisions and votes are not made. This was an opportunity to, in a sense, practice for a potential public hearing while providing direct education to county board on what Tobacco 21 is, what it entails, and the issues that their community is facing around the high prevalence of youth tobacco use. So who was all there? County board members, community members, youth, physicians, coalition members, school staff, public health, county attorneys, county administrator. It took about roughly an hour. Tony Buttacavoli, who is the public health director for Isani County, was the one who facilitated it, and then us as health educators did an educational session and PowerPoint just touching on the topic of Tobacco 21 and the high youth use rates. So yeah, thanks, Isha. You can stay on that slide for just 1 second. So in this meeting, we wanted to ensure clear direction to the board members on what was being requested of them. So after the after this meeting, they approved moving forward with drafting the language. There was a lot of work done moving forward with this from Public Health Law Center, as Isanti County strengthened additional components as well, such as increasing licensing fees and penalties to retailers who aren't compliant. Then October Okay, so I think, so we can still hear me, great. Can you go back a slide, Isha? Okay, great. So January 29th of this year, the Public Health Director and County Attorney presented a draft revised version of the County Tobacco Ordinance. And on February 6th, the County Board approved to set a public hearing date of March 20th, 2019. So we wanted to note that all licensed tobacco retailers needed a 30-day notice prior to the public hearing. So any retailers that this ordinance was going to affect received a personal letter from Public Health Department in the mail notifying them of the hearing of March 20th. Next slide, please. On March 20th, Isanti County Board of Commissioners unanimously passed Tobacco 21. This picture is a very, very small representation of the key community members who were involved in this work, including some youth, physicians, community health workers, public health, school reps, law enforcement, and the county board. Next slide, please. So our final step, which actually could be step 1 for a whole new realm of work around this new ordinance, is connecting with each retailer that is affected by the ordinance and doing direct education on compliance expectations if needed. The implementation date of this new ordinance is set for June 1st, 2019. So I will actually hand it back over to Isha.
Hi, can you hear me, Alicia? Sorry about that. I got kicked out by the webinar platform. So
that's okay. Yes, we can hear you.
Okay.
No problem.
Sorry everyone about that. And thank you so much, Alicia. You did some amazing work over the last over a year. So thank you so much. So talking about what if someone on the call, someone wants to take next steps in that community, what you can work on next. This is a map of everyone that has worked on Tobacco 21 across the country. There have been 7 states, 440 localities, so that's cities and counties that have passed Tobacco 21 in Minnesota. There have been 29 cities. Here's the list of cities and 4 counties that have passed Tobacco 21. There are several more across the state that are currently working on it. So this map is constantly changing. Just over the course of the last few weeks, I've had to update this PowerPoint presentation a few times, which is a good problem to have with all the cities that have been working on Tobacco 21, and there'll be more to come. There is a lot of support for raising the tobacco sales age. 75% of adults, 70% of current smokers, and 65% of young adults ages 18 to 24 favor raising the tobacco sales age to 21. The Minnesotans for a Smoke-Free Generation is a statewide coalition of organizations that share a common goal of saving Minnesota youth from a lifetime of tobacco addiction to tobacco. This is a list of all the organizations that are a part of the statewide coalition and all support raising the age to 21. And if you work on Tobacco 21 in your community, you might receive some letters of support from some, if not all, of these organizations for your community. If you're interested in doing this work, you will not be alone. There will be local and statewide support every step of the way. The Association for Non-Smokers Minnesota and American Lung Association both have technical assistance providers to help guide your policy work and share resources with you. I am the contact person at the Association for Non-Smokers, and Heidi from the American Lung Association is also the TA provider. So you may have worked with one of us. You can reach out to me. I can connect you with Heidi as well. We also have lots of resources. We have fact sheets, talking points, all the journal articles and research that I mentioned earlier, sample ordinance from other cities, from the Public Health Law Center. All of that is available. And then if you are interested in taking the next step in your community, we can do some assessments. We can provide sample letters to the editor, letters of support, PowerPoint presentations for your community or education sessions, etc. So finally, in summary, preventing youth from initiation is essential to creating a tobacco-free generation. 7 states and at least 440 cities have raised the tobacco age nationally. 29 cities and 4 counties in Minnesota have. There are resources and support available to everyone that's interested on working on this policy in your community. That is it. I'm going to open it up to questions now. Hope this was helpful.
Yes, thank you both to Isha and Alicia. I continue to get a kick out of how that rhymes. For all of the great information that you've shared. We'd like to invite you now, for those of you that have not already started, we invite you to enter any questions that you have about what you've heard this morning into the Q&A box. I have a few that I'll go through and direct to each of our presenters as appropriate. But in the meantime, please feel free to drop questions to us. We have about 20 minutes to be able to answer anything that you're curious about or that you're interested in understanding more. One question that is for you, Alicia, is what percentage of the schools in Iceni County complete the Minnesota Student Survey?
Oh, so there's 8 school buildings, and so I don't actually have a percentage, but I could probably figure that out, and I could connect back with you.
Yeah, that would be great. Maybe if you want to send that information to Isha and myself, we can share that with the folks who were participating today.
Absolutely.
Awesome. Great. I have 2 questions currently about whether, actually this is the 3rd question about this, is if today's PowerPoint slides are available. And yes, we can make them available to you after today's webinar. Reminder also that this is being recorded, so the recording will be up on the Minnesota Prevention Resource Center website probably tomorrow. So you're welcome and invited to view this entire presentation again, or to see portions of it, to remind yourself of some of the content or share it with others. And again, we will email out the PowerPoint slides to everyone that was that participated live with us today after the call to answer your question, Tracy. All right, let's see here. Another question is from Stephanie. She says, St. Louis County is considering doing a county-wide T21 policy. what is the best piece of advice you have for us moving forward? I think this can be for both Alicia and Isha. Great question, Stephanie.
Yeah, I can go first. So like I emphasized, probably overemphasized in the PowerPoint presentation, community support is really what you do need. And I would say along with the data to support. So moving forward, just ensure you have a broad representation and that you're really not blindsiding anyone and that everybody has an equal opportunity to be heard, because I think that was the biggest key factor for us, is that we had a huge community backing, and then when it came down to opposition with our board members, they actually said, you know, you've had ample opportunities to come forward and talk to us and express your concerns, and we're just now hearing from that. So that was a really positive move on our part, and that community support really, they were the ones doing the work. And at one point, we as SHIP coordinators were able to just almost take a step back and just be those convening pieces and provide resources. So
yeah, in addition,
wonderful.
Thanks, Alicia. Just want to add to something I mentioned to Alicia pretty early, was quality over quantity of support, and somehow Asani County was able to do both. They had a petition which last I heard had over 800 signatures, so I think it might have reached 1,000 signatures. So they had that quantity of support, but also that quality of the important people that they had on that coalition. So it's not about having like too many people on that coalition, but who are the people, like having youth present or having school counselors or school resource officers, just different community members present to be able to provide different voices was really helpful and balanced it all out. So having that different kinds of support is helpful.
To piggyback off what you both are talking about now, another question is, was there any resistance from county commissioners in Isanti during this process? And if so, how did you deal with that resistance?
Yeah, that's a great question. And so initially, we were pretty certain we had 3 supporting, and then we had 2 that were opposed, and they made it known that they were pretty opposed to it. With that said, that was at the very beginning stages, and we just said, you know, education is going to be key in either, you know, helping them understand the issue and framing it, or solidifying their stance and on the opposition side of it. So we did that committee of the whole meeting. They were invited to all of the community outreach events in the forum. We did one-on-one conversations, but we also, at the committee of the whole meeting, we did that direct education to them, allowed them to ask questions. And then after that meeting, the 2 that were opposed verbally came up to us and said, you know, we support this wholeheartedly. We just didn't understand the issue itself, and we didn't understand that our use rates were as high as they were. So that's kind of how we address it. Just education and having those conversations, and really not fearing the pushback, but kind of questioning, like, what can I do to help you understand this a little bit better?
Great. Yep. All right. Another question, gearing more toward some of that frequently asked questions in the community piece of the presentation. Patrick wants to know, how do you respond to stakeholders that simply say, it's going to pass, and then on the state level in the next couple of years, so why should we waste our time on this locally if it might take us the next 2 years to pass it here?
Yeah, I can respond to that briefly. So like I said earlier a little bit, it's more than just Tobacco 21. A lot of county and city ordinances are out of date. They don't have updated tobacco product definitions. They don't have their new violation structures. They sometimes might not meet the state minimum for tobacco ordinances for compliance checks, fees, licensing fees, etc. So it's just a good time to revise your tobacco ordinance that may be outdated and include tobacco 21 in it.
Okay, great. Thank you, Isha.
I also just want to add one more thing, sorry, Lindsay, about
No, go ahead.
understanding licensing authority a little bit. The reason Isani County was able to work on a countywide level on tobacco 21 is because the county licenses most of their tobacco vendors. There's only 2 cities in Isani County that don't license their tobacco vendors. One is the city of Cambridge, and Cambridge is in support of this and might be passing tobacco 21 locally very soon as well. And then the city of Bram, that we had the hardest time finding their documentation that they decided to license their own tobacco vendors. And during this process, they actually decided that they wanted to hand over their licensing to the county. So it would apply to them as well, tobacco 21 would. So it's important to know who licenses the tobacco vendors in your community. If the city licenses, then you might want to work in the city on tobacco 21.
Yes, great. Thank you so much for adding that in. So to Sandra, her question was, did you have cities in the county that implemented first? Was it a countywide effort from the beginning? Which is easier? So to Isha's point, really understanding the licensing structure first is where you want to start if you're looking at beginning to work on this in your county or in your cities. Thank you for adding that. All right, I'm looking through some of the other ones. Let's talk about Megan's question. She asks, can you clarify the fact that T21 limits point of sale purchase to 21, but the PUP penalties, that piece doesn't enforce purchase consequences? She's a little unclear on that piece. So Isha, could you maybe talk again about those pieces of the policy?
Yeah. So tobacco 21 is about the seller not selling, making sure they are checking IDs and not selling to someone under 21. PUP, so purchase, use, and possession. So an individual use would not be criminalized for purchasing tobacco or using tobacco or possessing tobacco. It is all on the vendor. That's where compliance checks come in, and cities and counties ensuring the licensing authority, ensuring that they are regularly conducting compliance checks, and local vendors are not selling to minors. And that is also where updating tobacco ordinances comes in to make sure your violation fee structure is updated and increased if needed to increase penalties for retailers that sell to under 21.
Great. Thank you for that bit of clarification. There is another question related to this from Steve. He says, I appreciate the value of decriminalizing possession and use by underage users. So related to what Isha just talked about. He also then shares that the Minnesota State High School League policy, so for high school sports, says that violators of their zero-use policy cannot participate in state high school league activities. So meaning that if a student is caught using a tobacco product, that would put them in violation of the zero-use policy. So his question is, how is this addressed in the context of decriminalizing possession? So do either Isha or Alicia, you have any knowledge of maybe how schools in Isanti are dealing with that zero-use policy, knowing that the actual ordinance is focused on retailers as opposed to youth who use?
Yeah, I don't, Isha, do you have any input on that?
I was kind of thinking, so this might be separate. This is a little more about what schools are doing. If the hockey league is sorry, I lost your question. Is not, I think that's their own policy. Schools are addressing it themselves with school resource officers, educating, etc. But yeah, I think that's all I have. I don't have anything else. It's not about criminalizing, it's about the sellers. Sorry.
Alicia, do you have anything else to add anecdotally about what schools in Isanti County are looking at related to this?
You know, I know they were looking at just taking a deeper dive into their local or their school policy, but I guess if it's a Minnesota, like overall, the high school league for sports, I'm not sure how they are going about addressing that. So again, I just want to emphasize what Isha was saying. You know, we really want to remove the criminalization on kids and students, and I mean that's the last thing we want is to take away like their positive extracurricular activities, you know, as well. So I think we're just going to have to do some outreach to the school and work with them on potentially looking at their local policy and see how we can maybe work in collaboration with the Minnesota League to see if we can adopt or strengthen the local school policy to maybe remove those at the local level.
Steve just wrote back that this is definitely a tough question, so thank you for discussing it. I think where it sounds like we're kind of landing is we're talking about two different policies.
Yep.
And so out in the community, the focus in the public health strategy is on holding retailers accountable, and that, Steve, like you've shared in the Q&A box, that doesn't necessarily translate directly to how schools and the state high school league figures out their own procedures for holding youth responsible, and there being consequences as well. So Alicia, I think what you're saying of maybe this being an additional place where coalitions can get involved in kind of working out or helping support how schools think through that.
Yep.
Is maybe the next step. But yeah, definitely a tough thing to consider, but very worth the conversation. So really great question, Steve. Thank you for that. I just, with the few minutes that we have left, I want to get at a couple of the other questions here. Let's see. Gretchen has a question for Alicia. She said, when you were doing outreach in the community, you mentioned that you focused on educating about the harms of tobacco mostly and didn't talk about the policy strategies. Can you talk a little bit about the decision behind why you used that approach?
Yeah, absolutely. So I will give credit here to Isha on that. That was a decision that we kind of decided collectively on when we're doing these public outreach events. You know, policy work sometimes can be over individuals' like heads, or they really are there to just gain that education and awareness. And so also too, we didn't want to provide the opportunity for opposition to start in the very beginning process throughout this whole the whole implementation period. And so we actually decided not to decide on that policy decision until after the forums with the coalition, the smaller group of people, based on conversations that they were having within their community. So we kind of really wanted it to be a community-driven effort, and we wanted it to be their decision. Going into this, we didn't necessarily think Tobacco 21 specifically. We did provide the coalition themselves the green to red map with some of those options that I showed you previously. So we really wanted it to be their decision, and this is what we want for our community. So I hope that good.
Great. Another question is from Ashley. This is a larger question, more on a technical assistance level. She's wondering if it would be possible to have a call for everyone that's working on this topic within the state to continue to get some of this brainstorming and these questions answered as people are working through. Isha, do you want to speak to that?
That is an interesting idea. I guess we hadn't thought of a call for everyone. I think the reason behind that is that everyone is in different stages of the work. Based on what people say, we usually kind of provide them feedback one-on-one. I also want to add that there are SHIP point of sale calls that provide regular updates on the work, so you can ask questions there as well. So yeah, it's really dependent on each one's strategy. Sometimes when recently, if I got a question from Stearns County, I mentioned what Isani County did, or if they have a question regarding what someone else did, but we haven't done group calls because everyone's at different stages. Each community is different and has different needs. But if you have a question about who's working on what, I think the SHIP point of sale calls would be a better place to get that information.
And so, Isha, if someone were interested in joining those calls, if they're not already a part of it, would the best route be to contact you?
Sure, yeah. If you are a SHIP grantee on this call, a public health person on this call, you can have access to Basecamp. You should have that information. Otherwise, I can provide that information to you.
Okay, great. I think we have time for one more question before I share just a little bit of additional information with everybody about other learning opportunities that are coming up. So the final question is kind of a twofold. It's who typically is the biggest opponent to this policy? Is it individuals? Is it retailers? Someone else? And then as far as enforcement goes, what's working best once a policy is passed to enforce it?
I can go. The biggest opponents we have seen across the metro and in Isani County as well was retailers. Definitely there were two. One is an e-juice manufacturer person, and one has a tobacco shop in Isani County. So I think one of the most interesting things that happened at the public hearing was that one of the county commissioners, the chair, I believe, talked about the difference in the number of support versus the opposition for this policy. He, I think, mentioned it was like 10 to 1. Every time he got an email regarding opposition, there was 10 people in support of it. So that was there wasn't a lot of support. There were only 2 people at the public hearing that testified against. So I don't think there are individuals. It's mostly retailers.
I will add a little piece to that, Isha. So from Isani County has a Facebook page too, and so I think they opened it up for public comment, and the opposition, the most that we saw was from like the 18, 19, 20-year-olds who were questioning if they were then going to be able to be grandfathered into this new ordinance, and no, that's not the case. And so I think that's where we saw our biggest opposition, was those 18, 19, 20-year-olds.
Very interesting. Appreciate that perspective. Very briefly, because we're right at noon, Isha, do you have any advice for enforcement?
Enforcement is educating and informing the retailers. We have like template letters to send them, letting them know well in advance when is the implementation date, and then also if we can provide signs, like we don't have printed signs, but like template design signs that you can customize and print, that you can that retailers can put on their storefronts or by their cashiers. There's also the Stop Sales to Minors retailer training. It has a state information, so that has 18, but it's just a generally informative training for retailers to know the different tobacco products and not selling to minors. Yeah.
Great. Okay.
Yeah.
Wonderful. Thank you. And so again, we will be sharing the slides from today, which include contact information for both of your technical assistance providers, which includes Isha. I want to just end today's presentation. Isha, if you'll go to the next slide, with just letting you know about a couple of other learning opportunities that are coming up from Minnesota Prevention Resource Center. So if you enjoyed today's webinar, about a month from today, almost exactly, I think, on April 30th, our next webinar will be called Persuasive Confidence. This is the first in a three-part series with David Mann, who was the keynote presenter at last year's Minnesota Prevention Program Sharing Conference. For those of you that were with us last year for that, Persuasive Confidence is really going to be about the communication skills that you need to help persuade people in what you need to have happen as you're creating community change, whether it's getting a new stakeholder involved in your effort, or it's helping persuade a county commissioner to understand your perspective on Tobacco 21, for example. He'll be walking us through different skills that you can practice in continuing to build those skills and feel confident in your persuasion and in your communication with those that you need on your team. The other couple things that you see on the screen are that we have our core prevention training, substance abuse prevention skills. The next one is being held this summer in Bemidji, followed by ethics and prevention, June 7th, also in Bemidji. And then finally, if you'll go to one more slide, we like to remind you to save the date for the conference that I just referenced, Minnesota Prevention Program Sharing. It's going to be in Duluth this year, October 24th and 25th, and registration opens June 11th. So we hope that many of you will be able to join us for that. And with that, thank you so much again to Isha and Alicia for all of the really great information you shared today. Thanks to all of you who asked questions. I think that was a really excellent discussion, and I thank you so much for your participation today. We'll make this recording available at mnprc.org/resources, and we hope that you'll join us again for an upcoming training. So have a wonderful rest of your afternoon, and we will see or hear from you again soon. Thanks, everybody. Take care. Bye-bye.
Thank you.